Hi, take two. Okay, so I just want to say something that I'm going to try to get out really quick, right? So I don't like video editing. I hate it a lot. I'm used to doing like writing editing, like that. I've been doing that the longest time, right? But like video editing is just very, very new to me, like only like end of 2016, even if that kind of thing. So video editing is not my forte. It feels like it's very technical, very mathematical in a sense. It's very detail oriented, and I'm a detail oriented person, but it's just very meticulous and very like if you fuck up one thing, then the whole thing is fucked up. It's like that, and I don't know. Maybe it's just my laptop because it's old and everything, but if I try to export it, sometimes the quality is really shit, sometimes it's really good, sometimes it's not. It's just a whole mess, and I hate it. So I don't know why I have a YouTube channel if I hate editing so much, but I do for some reason. We're in this paradox of time that I have a channel and I make videos and I do things like that. I don't know. I just to get that just putting it out there. I don't like it. This is why I never had videos up because I don't do it. But anywho, not the point of the video. The point of this video, this is the second take, is I'm filming a video about trichotillomania, and if you don't know what that is, stay tuned. You will see and find out. But if you also don't know what it is, like really, it's a hair pulling disorder. It's in the body focused repetitive behaviors. That is like the classification of it. I'm also going to be talking, well, I'm going to talk about trichotillomania, so hair pulling. I'm going to show pictures, so if that is something that triggers you, don't watch this video. And I'm also going to talk about dermatillomania, which is skin picking. So if that triggers you, don't watch this video. Although I don't think I don't have any pictures for derm. So, but I'm going to talk about it, so. But yeah, the trichotillomania definitely has pictures. I'm going to tell you a little bit about my history with trich. I'm going to tell you about how bad it's gotten, the distinctions between self-harm of trich and like OCD based like trich, how I define it at least. I'm going to show you pictures of some of my worst trich moments. I am going to talk about and show you guys my prevention techniques, all of that jazz, all the shit on the bed. I'm going to talk about all that as a way of kind of moving forward with it and essentially accepting that trichotillomania is like most things. It's a process. It's a journey. There are wins, woo, and there are lows and loses. There are losses. So that's what this video is going to be about. So let's get into it, right? Let's do it. I don't know what I'm doing. Okay, I'm gonna cry. I'm not gonna cry. Okay. Alright. So, let me talk about my history with trich. So, trichotillomania, again, as I mentioned earlier, it's like a sort of an anxiety, OCD based body focused repetitive behavior kind of thing. If a person is feeling in distress, they may go to pull, hair pulling. You can pull really from anywhere. Like people pull from their head, their like eyes, and eyebrows, and arm hair, pubes, everywhere, anywhere. You know, people typically have like a particular part that they pull from. For me, for instance, I only pull from my eyebrows and my eyelashes. It's kind of it can be painful, but not like a lot and not very much. I use my index finger and my thumb to pull them out. Like sometimes it's ow, but most of the time it's not. It's painless. It's no sort of thing. I'm going to talk about sort of specific things that I do with it. And particularly with the skin picking, it's going to get a little different. But I've been hair pulling since I was about 13, and I'm 26, so, yeah. Hair pulling disorder, that one is the longest mental health condition I've had that predates back before I even dealt with OCD when I was like 19. like when I started having symptoms at 19, and then when I was diagnosed at 21. It was always, I think it was for me, it started out like I would get a lot of my eyelashes would fall out, so I would get like a clump feeling, which I still get sometimes now. Like it just, like the eyelashes just kind of like clump together, and then it annoys me and it bothers me. So I went to pull them out to kind of like alleviate that, and it kept falling into my eyes and everything too. So I started doing it like that. I used to have like pretty bushy eyebrows and everything too, so I didn't like that. So I would like, you know, pluck them and stuff, which I guess is one of those like weird, not weird, it's a judgment, but like an interesting factor because of the societal, like, women should be plucking and things like that. I don't know how much that really had to do with my own hair pulling and such, but I didn't like how thick my eyebrows were, so I started plucking them with my fingers and everything and all that kind of jazz. And it wasn't like, I think I had gaps in my eyelashes, but I think that was probably at the furthest extent of it for a long time. Then when I was back in like 2017, so I would say, okay, hold on, backtrack. So yeah, I'm gonna have pictures of a couple of times back in like 2016, even, of like how I looked and like my face and all that kind of jazz, which is difficult because I don't like how thin I was back then, but just gonna go somewhere with that. This is a very strange video. How to do this without being triggering? That's the real question. What were we talking about? Trichotillomania. So it didn't really get really bad until 2017. Okay, we can talk about self-harm versus OCD-based distinctions. So I had always read about like the different types of self-harm, because there is cutting self-harm, there is scratching, which is the type that I used to do. There it would be like bruising, hitting your head, all those kinds of things. There's like a lot of different types of it. Even like eating disorders, drug abuse, that could fall under self-harm. The one that I never really understood and never really agreed with was the hair pulling. And I always thought of it like, that's not, because it's not the same thing to me, at least. And I found out what hair pulling self-harm is for me in 2017, because at that point, like, I would pull, like when I would pull, and I define it still today as like OCD based. It's like, okay, I'm feeling anxious, so I'm starting to get, you know, say I'm watching like an upsetting video or something, right? Like some like compilation of people yelling at other people. So I would start, you know, pulling. It's a self-soothing kind of thing. Like I'd pull to like make myself feel better, kind of thing, or in the hopes of feeling better, or at least not as anxious. So what I would do when it was OCD based is I would kind of pull it out. I'd pull the hair out, and then I'd rub it in between my fingers. And then a lot of the time I would kind of keep it in like a little pile, and I would count how many hairs there were. So anything under 10 is just like OCD based trich, so not self-harm. And then anything, if I pulled out like 10 of like 20 of them or more than that, then that is what I constitute as self-harm. So when I would just like localize it and maybe have a couple gaps or something, that, and it would be under 10 hairs, then that would be like OCD. That was just that. But if I like pulled until my entire eyebrow was gone, which is what happened in 2017 multiple times, then that would be self-harm. Because I like don't stop. I just do it until there's nothing left. And I'm a very, dealing with borderline personality disorder, I'm very all or nothing. So a lot of the time I'd pull a bunch and then I'd be like, well, fuck it, might as well just take the whole thing out. So then I would continue going. And that's how I define the self-harm. But part of it is like I don't stop. It's like I can't stop, and I just keep going until there's legitimately nothing left. So that's how I define it. I define it differently in that sense. I don't even really rub the hairs that much. I just keep going. There's something about pulling at night, especially. It's almost like when I'm pulling at night and it's dark and my lights are out, like everything like that. Even like, especially like still today, I don't really totally remember all the other past times I did it, but especially today when I pull, I'd say even in the last year, maybe 2 years, so like 2018, 2019, 2020, when I would pull at night, it was almost like it wasn't happening. Like there were no consequences to it. Like I could just pull until I felt better, and even then I don't really feel better, because then if I go and look in the mirror at the damage and I'm like, oh crap, now I feel bad. And that's how I find my relationship with mirrors. With like I have a handheld mirror, you know, to put on lip gloss, which is the skin picking stuff, which I'll get to in a little bit. But hopefully this video isn't too long, because I need to make it short, because I don't want to make it that long, but we'll see. But I have this little mirror, and when I look at it, when I'm, you want to see yourself? Right. When I look into the mirror when I'm pulling, it's actually not helpful, because I'll like see the damage, and then at that point I'm like, oh well, fuck it, might as well go all the way. So then I keep pulling, or sometimes I use it to help me to pull and things to that effect. So I don't find that helpful. I have found, okay, I found that yeah. So I don't know what I'm saying. So that would be how I distinguish between OCD and self-harm. I do it a lot of the time when I do it at night. It's like nothing else matters in a sense. It's a very like escapism kind of thing, and it's almost like nothing happened until I wake up the next day and I'm like, oh wait, where's my eyebrow? And then it's gone, and I'm like, shit. So then it's more of an issue, and I don't even know how. Back in like 2017, 2018, I don't know how I like, because I didn't cover it up. I would just like, I would do this with the scratching as well, but like, it was like, I would, if I pulled my eyebrow out, I'd be like, well, now I have to wear it as like, that's my consequence, so I shouldn't do that, because then I'll have to bareface and walk around, and people will only see me with one eyebrow, and then, you know, all this kind of stuff. So I would kind of like accept it as part of my fate, in a sense, my consequence. But I think that kind of bred into the shame of it too, of like not covering up in a sense, and then like it would kind of keep me within that cycle. So then I would wind up pulling more, and because I have photos that I'll show that some of them are like a few days apart, like I pulled one day, and then like 3 days later I pulled again, and then 3 days after that I pulled. So I don't think it was probably very healthy, to be honest. The biggest thing that I have found that has helped me has been breaking that cycle. So like breaking the shame and stuff. I can't really do much about my eyelashes when I have gaps. Even right now there are a few gaps, but in my eyes today, as of June 2020, they are the most full and like luscious as they've ever been in my life. So that's really awesome. For my eyebrows, like I do cover them up with makeup. I just draw on brows, which you will see, because I have filmed clips of that, and I find that helpful. There's something about the illusion of having my eyebrow there that I allow it to grow back, and I don't always pull as much from it when I have them sort of on. Last night I kind of did, but I was also skin picking a lot. So the big thing too that I found was, I think back in like 2018, I started really getting treatment for the more some of the other self-harm stuff, and definitely the suicidality. And I found that as those things faded away, the trichotillomania got a lot worse, or became really the only focus of like symptomatic stuff that I was having. And then when I started tackling the trich, then I developed skin picking, which skin picking, again, technically I've had for the longest time as well, in a sense of lip picking, but as again, the separation between just lip picking is like, it would be uneven, and then I would pick my lips, and then, or if I was like nervous about something, I'd like, you know, chew on my bottom lip, like that and stuff. But when it became more of an issue was when I would go at it and like wouldn't stop, and it would be bleeding and like all that kind of stuff. And then I saw someone else actually doing it, but I started picking at my scalp, and then I started picking at like my face, like if there were dry spots and skin like that, and I would start doing that. So even like yesterday was like I was picking, I was picking my face, I was picking my scalp, and then I wanted to picking it, pulling at night, pulling, blah, blah, blah. But yeah, I went to pulling at night. So the other thing that I have found helpful is there's something about if I can keep my hands busy. The worst thing about having self-harm related to my hands, I find, is that I can't like leave them somewhere and then like wander off. Like I'm always with my hands. So there's that kind of challenge. I have tried in the past like putting on gloves and such, because again, probably pre-2018, I would have the most trouble because I'd be half asleep pulling and everything. But as of like middle 2019, I'd say that I have eliminated that type of pulling. If I pull now, it's more like when I am aware of it and I'm awake and everything, or I'm trying to go to sleep but it's not working for whatever reason. The other thing has been that I've been getting itchy eyes at night, and so when I get itchy eyes, I'm kind of already in the vicinity, so then I start pulling. The other thing I would say is like breaking that cycle is really important, the shame cycle kind of thing. Like just kind of trying to like radically accept it and just be like, okay, well, I don't have an eyebrow, or like I'm missing part of an eyebrow or something, and now I have to just kind of put the makeup on and just move on with my day, just distract myself from it and just try to cope in a different way. I find that to be helpful. I have also found that putting things in my mouth, like having things in my mouth, keeps my hands busy, particularly with candy. If I can chew it all up into nothingness in a sense, that kind of relieves that urge from my fingers. If I have something in my mouth, so I chew on like ice cubes, that definitely helps a lot. That's always been helpful for me. Chewing ice cubes, like chewing on hard candy, even just like if I don't even have candy, like cough drops or something, like chewing on that. Again, it's that like turning something into nothing. That's something that I really kind of like am attuned with and like really kind of fixate on. Something to keep my hands busy. Sometimes just even like putting my hands farther away from me is helpful. I hold on to like a stuffed animal at night, so like having that, you know, that even having my hands too close to that might be too close to my face, so I kind of just like put my hands away, like hold them, and like no, and that kind of thing. That's helpful. We're moving into the helpful sort of area of it. Something that I want to mention with the skin picking is that after a while I started doing that kind of, I guess it's kind of something into nothing, where when I'd pick at my scalp, I'd pick at my face, I'd pick at my lips, and then I would also stick my fingers in my ear, which I still am doing as of today, like as of this last like month or so, I'd say. The problem with that is when I would put my fingers in my ear and I'd be itching around in there, because part of it was itchy, but then like my skin started getting scaly and stuff, and it was like not good, and then I started getting otitis externa, so which is like a middle ear infection. So I was actually giving myself infections, which is not good, and it was painful, and I can have like bumps over here, and I don't know why, but yeah, so it's a whole thing. But when I would do the ear picking and the scalp and the face and the lip, I would eat the skin afterward. Again, I know it's a little different. But again, for me, it was sort of like, if I eat it, maybe it's like maybe it never happened in a sense. So is that, I don't know. But I just wanted to mention that because we're already in this video, so if you've lost all respect for me, then I guess that's it. But that's just how it is. So I don't eat the hair that I pull out. I only eat the skin. But ways that I help. So ways that help me is like integral to this whole process. So I've actually, like I've said, I have made strides when it comes to curbing the trichotillomania. It's harder when it's like I start curtailing that, and then the skin picking gets worse, or like I oscillate back and forth between the two, which is really annoying. But I have found ways to like lessen it, and the big problem I think I have is like I get cocky, and then I'm like, oh, I don't need those like prevention techniques anymore, and then I like don't do them, and then I wind up having a loss, and then I wind up pulling or picking or whatever. So it's like a double-edged sword kind of thing. Maybe if I look at it as like self-care rather than like trichotillomania prevention techniques, I don't know. Maybe that'll help. Like framing the way I think of it in a sense. Maybe that would help. But for the lips, so we'll go in order. Lip picking. So I found that chapstick helped a lot. It's like a lubricant in a sense. It would help kind of block me from picking with my fingers or like even with my teeth and stuff. I graduated from lip balm once I lost like 2 of them in my room. Then I went to lip gloss, and then I got a bunch of lip gloss because too much Jenna Marbles. So I got a bunch of lip gloss. So now I have plenty of lip gloss, and I use that as like a way to like prevent myself from picking at my lips, which is very helpful and very effective. Ear picking, I haven't really found too much to help with that, honestly. Scalp picking, probably putting on hats is helpful. And just kind of not doing it, like just holding my hand somewhere else or something to that effect. Pulling, again, I was able to knock off sleepy pulling, which is good. I really haven't done that in over a year, probably. I would say though that like lotion is really good, like scents. The things like when I go to sleep at night, I've noticed lately that like my nose is stuffed, so I can't smell anything. So even if I put stuff on, I don't really smell it very much. But I could always spray perfume in the air. Like this is helpful. Just put it on my body. I have like little like de-stress aromatherapy lavender kind of stuff, so I put that like on my wrists here and rub it, and then on the back of my hands rub it, and then on my jawline, and then down my neck. I've been doing that. That does help. It's not always foolproof. I would also say that except for last night, my hair quality was actually down in the last couple of weeks. Like I hadn't been doing it, so it's kind of just that like radical acceptance of it, that it's going to be something that I struggle with for a while. But that doesn't mean that I will like I might always have it. I might always have the urge, but that doesn't mean that I'll always act on it. So that's like a helpful thing to remind myself of too, that like it's kind of, it comes and goes in waves. Like it's a struggle for me right now, but like it's better because I can pull my whole eyebrow out and not go to the hospital. So like it just doesn't equate to being hospitalized. So kind of taking it for what it is and just kind of having some gratitude, I guess, about it. Like it could be worse, kind of thing. What else? Music, actually, and ambient sound is going to be helpful. I'm pretty sure I was trying to listen to a different ASMR video last night, and that wasn't really helpful, and then I was kind of pulling and stuff in between that. Gloves, helpful. So different ASMR, like if I'm in the mood for like listening to like creepypasta, or like if I'm in the mood to listen to an ASMR, I like Dennis ASMR, especially as of late. Creepypasta, like Creeps McPasta, or Mr. Creepypasta, or Dark Siminium, Mr. Creeps, all that kind of stuff. Or like Calm app, like scene stuff. I've never used my official noise machine, but I probably could. Knowing when to get up is a big one. So like knowing like, okay, I need to like move like out of this bed, so I'm not doing that behavior kind of thing. That would be helpful. I did that on like Monday. I went downstairs when I was skin picking. I went downstairs, I ate some ice, and then I went back up, and then I went to sleep. So that was good. Like I prevented that from happening that day, which is awesome. Probably celebrating my wins, celebrating the fact that I haven't done it in a while, or that it wasn't, I still, today, again, you'll see how it happened, like what was left, but I still have the rest of my brow, and I still have the rest, I have my other brow, so.
We're in the same boat, heading for different shores, facing each other, grasping at different oars. We're cornered in a state